call Alec Rowley to be followed by Sandra White. Mr Rowley, please.
Thank you, Presiding Officer. I would want to begin by congratulating and thanking Lewis MacDonald and the Health and Sports Committee for producing this detailed report, which I think will be very useful moving forward to stage 2. I know that Jean Freeman, the Cabinet Secretary for Health and Sport, issued a response to that last evening. I've not had a chance to read that properly, but again, I think it will be useful moving forward. I take the point that Keith Brown makes about focusing on the purpose of the bill, and he says that it's about appropriate staffing and safe staffing. But it's a bit like the Emperor's clothes. If you don't have the staff, then appropriate and safe staffing will be difficult to achieve. And it reminds me a bit of legislation where you legislate, and I question, the legislation in the terms of you legislate to give people a treatment guarantee. And you then, of course, recognise, and we know that having a treatment guarantee does not guarantee people treatment when they actually need that treatment. And therefore, the very question of what legislation purpose is for is something I think that legitimately we need to ask in terms of this bill and perhaps some other bills that are making their way through Parliament at this present time. I do note that the Royal College of Physicians raised a few issues, and they say legislation alone will not fill the rota gaps and vacancies in the workforce. The recognition in paragraph 97 of the policy memorandum that there is currently significant challenges in recruitment in both health and care service settings needs to be addressed, and I think we really do. Yeah, absolutely.
Cabinet Secretary.
I'm grateful to Mr Rowley for taking the intervention, and I'm sure he will acknowledge that I have never at any point said that this bill will automatically by itself produce the numbers of professionals across health and social care that we need, but that what it is an important additional tool to help us workforce plan as well as we can, getting the information via the application of this legislation to ensure that we have evidence, robust evidence, in order to identify how exactly we should continue to increase the numbers we have in training in nursing, in medicine and in our allied health professionals. So it is one of the tools we have. It's not the automatic silver bullet to fix the problem.
Alec Rowley.
And I think Monica Lennon acknowledged that when she opened for Labour and said that we, in principle, support this bill, but we need to do quite a lot of work on it. And there are some serious questions that have been raised by the third sector, by COSLA and others that need to be addressed going into stage 2. But nevertheless, I'm sure as parliamentarians, we all know that our constituents out there are asking the question, what are we actually doing about the staff shortages that does ensure that people are not guaranteed the health care they need when they need that health care. If you look, for example, in Fife, at the current time, there's 7 practices in Fife that are registering as being in difficulty, high-risk situation. NHS Fife say they can't recruit the GPs. There are practices where they're having to close their lists. There are currently 16 practices that are full. Now, that's not just about accessing GP services, as the Cabinet Secretary knows. That's about accessing a whole range of community health services that would be part of a holistic health service. Those services are struggling right now, and my constituents are saying to me, what are you doing about that? And I ask myself, where does this legislation actually provide that support? And I think we need to be honest with the public, and we need to start addressing the big issues that are in health at the present time. COSLA make a point in terms of social care. COSLA, by the way, have produced a 2-page briefing that is highly critical of this current legislation, and I think we need to address that moving forward. But they say the bill is poorly timed as the social care workforce is experiencing challenges in terms of recruitment and retention. I would say that we need to look at social care. I think Monica Lennon spoke earlier about 70 years of the NHS. The NHS in 2020 is going to be looking a lot different from when it was established back in the late 40s. I don't think we've actually asked the question and looked at what does a modern-day National Health Service in Scotland look like. And part of that is, of course, social care, and that's why we wouldn't necessarily sign up to what COSLA has to say here about social care being separate. But the fact is that currently social care is provided through local authorities and health boards. It's provided through the third sector, and that's why we have so many third sector organisations coming in here with concerns, but it's also provided through the private sector. And one of the major problems in recruiting for that social sector is lack of job security, poor pay, poor terms and conditions. So what would a National Health Service look like in 2020? A National Health Service is not built just round about hospital buildings. A National Health Service is caring for people in their own homes. But why should that workforce be on the minimum wage or the living wage when other parts of that workforce are paid a more decent pay and have decent terms and conditions and have job security? So what does the workforce of the National Health Service look like moving into 2020? And should all those social carers be part of the health service? Or are we going to allow the modern health service to be split into a private sector provision that pays lower wages, terms and conditions? So we need to invest in our workforce, and we need to ask some fundamental questions about what that workforce looks like moving forward. So I say to the Cabinet Secretary, Labour will work with you on this, but we think we need to be more bolder, more radical in looking at what a modern health service in Scotland looks like.
Thank you very much, Mr Rowley.